Subcommittee 1 is now called to order. Human Services is our subject of today. I want to thank you all for being here as a part of this hearing concerning obviously a very important matter to everyone in the audience and beyond. At this time, we have a special guest who will be with us. I know that she's on a very short time frame. We're going to call the Secretary for the California Health and Human Services Agency, Secretary Diana Dooley, to come and to address us concerning issues in the Health and Human Services Agency. Thank you so very much for being here.
Thank you, Dr. Weber. It's my pleasure to be here. I very much appreciate the invitation and the opportunity to kick off this important subcommittee hearing. I was specifically invited to give you a little background on the origin, the process, and the results of the Developmental Centers Task Force, the future of the developmental centers that we established last spring. The origin of the work came from my own engagement over the first couple of years of this administration with the issues associated around the developmental centers. The summer before, in the summer of 2012, the legislature imposed a moratorium that we agreed to on the admissions to the developmental centers, and we were in the process of closing one of the developmental centers at Lanterman. As I began to engage with advocates around the issues associated with the centers, one at a time, it became very obvious to me, as it did to the legislature, that there was a wide difference of opinion about the future of the developmental centers. And at one extreme were advocates who wanted to close the developmental centers immediately, just shut them down, and that became sort of a rallying cry. And there are families that have spent their entire lives, residents of the developmental centers that have really never lived anywhere else and have been there for 40 or 50 years. So it occurred to me in that environment that I should make an effort at bringing the parties together. There wasn't high expectation about the opportunity to actually reach consensus, but we tried, and I came to the legislature in the late spring last year and stated my intention. The legislature incorporated that in the budget with control language that compelled me to do what I had suggested I wanted to do anyway. And so for the following 6 months, we convened with a group of about 20 people that represented the entire spectrum of families, patients, consumers of services themselves, labor unions, community providers, regional centers, advocates from across the spectrum. We held public meetings. There were public members present at the meetings and commented. We had work group meetings in between those sessions. And at the beginning and throughout, we kept as the focus of our work the beneficiary of services. There are over 260,000 consumers of developmental services in the community, and about 1,100 now remaining in the developmental centers. A year ago, there were about 1,500, and so it is declining. The trend is clear that without an organized approach to the future of the developmental centers, that and the effect of the moratorium, it will continue to decline. We worked very hard and very cooperatively and very openly and very honestly together over 6 months, and it resulted in recommendations that were a consensus report. That nobody got everything they started out thinking they wanted, but we all listened to each other, we respected each other, and in addition to producing a report that creates a roadmap for the future of the developmental centers, it created an atmosphere within which we can continue that work. The recommendations centered around 3 categories of people who are served in the developmental centers. Those with very complex medical needs, those with very complex behavioral needs, and those that are in the centers because of engagement with the criminal justice system. There was a recognition that there are some services that will need to be continued to be provided by the state, and a process as we go forward for evaluating the needs. The needs as we go forward fell into 3 broad categories. The services of the people who are currently residing in the developmental centers. What are their individual plans and needs, and where can those services, where can their needs be met over time? The second sort of category, and what we do with those programs. The second category had to do with the workers in those developmental centers. There's a strong body of skill and experience that has been developed and respected of the people who have committed their careers, their professional lives, to serving those with the most complex needs in the centers, and a recognition that we should preserve that investment. And so we need to continue to work with the workers in those areas and look for ways that we can create resource centers or continue to use the skills that they have developed. And the third category of issues that needs further work is the use of the facilities themselves, the property, the land, the buildings, and how we go forward to create a resource center, both for those who are being served in the developmental centers now and for those who are served in the community. So at a very high level, that's the background, that's what we did and how we did it, and that's where we are now, and the work that is the blueprint for us to continue as we move forward. I'd be happy to answer any questions.
I'd just like to once again thank you for being here and personally reporting to us, and also for following up on your announcement in this committee, in this room last year, that you were going to take these initial steps and set up a process, and I think that is underway and very much appreciated. There's a lot of complicated issues that need to be worked out, but I feel like the first steps have been taken. So.
Great. Thank you very much,
Thank
Mr.
you.
Chesbrough.
I just would join in that.
Thanks, Roger.
Okay, fine.
Thanks.
I'm sure we'll have lots of other questions concerning developmental centers, but want to thank you for coming. I know you're on a short
Well,
list.
I'm chairing the Olmsted Committee
Yes,
today,
that's
and we
what I
were
know.
discussing this there as well.
Exactly, but I appreciate you coming and
I appreciate the
and
invitation.
sharing that information. We look forward to additional updates as it proceeds.
Whenever I can be helpful, just ask.
Sounds good.
Thank
Thank
you
very
so
much.
much.
Okay. At this time, I'd like to call forth the Director of the Department of Developmental Service, Santee Rogers. She gave me all these questions from here. Yes.
Good afternoon. I'm Santee Rogers, Director of the Department of Developmental Services. It's nice to meet you, Dr. Weber,
Good meeting you.
and committee members.
Can
I'd like to
can I
ask-
interrupt for a moment and just say congratulations?
Oh, thank
I
you very
guess.
much. Thank you very much. Coming from you, that's terrific. Dr. Weber, I'd like to invite up my Chief Deputy
Sure.
and the next Deputy, Patricia, for Community Services and actually developmental centers, so it'll expedite the transition here, if you don't
problem.
mind.
Yes, most definitely. And
Okay.
I think there's some folks from LAO, Department of Finance, Tony Anderson, Catherine Blakemore. You can- I don't know if we have enough seats. Let's hope
we
so. I think we're all there now. We're all there. Catherine and Tony are still in the audience. Okay, fine. Thank you.
Also, Dr. Weber, I'd like to take a moment and suggest to you a serious loss to our advocacy community in California, and specifically South Central LA. A few days ago, an incredible woman and a leader in that community went to heaven. She's listening right now. That's O.V. Smith. Ms. Smith is an extraordinary person that some of us had the pleasure of working closely with, and she always would be our teacher and would not hesitate at all to tell us what we should be doing and when we should do it. Her investment in that part of California and across the state as a provider and as an organizing of advocacy is legendary. And I know all of us in this room who knew her, and especially all of you who might have known her, would join me for a few minutes of silence to recognize her great contribution to the people of California. Bless you and keep you, OV. On behalf of the Department of Developmental Services, I will take just a few moments to give you just a quick overview of where our budget is, the year that we're in, and where we'll be going in a short period, and then we'll move through the agenda as you have laid out. Department of Developmental Services budget for 13-14 is $4.9 billion. $2.8 billion of that is general fund. The Department of Developmental Services budget and the governor's budget for 2014 is $5.2 billion and $2.93 billion in general fund, an increase of 4.4% over 13-14. Department of Developmental Services, as many of the people in this audience and many of you already know, is currently serving over 267,000 individuals through our 58 counties in California. Many of those individuals have the diagnosis under the Lanterman Developmental Disability Services Act with intellectual disabilities still in the act and changing mental retardation, autism, cerebral palsy, and epilepsy. It's an incredible group of people and families, all of whom are very well involved in this great piece of civil rights legislation called the Lanterman Act. Services are delivered in accordance with this act for over 36 years. Those of us who were just coming as professionals before the act actually was conceived and legislated, we got to hear those moms and some dads, but those moms in particular, advocating for their sons and daughters an option for them outside of the 15,000 people currently living at that time in state institutions. It was an incredible piece of advocacy, and it eventuated into this incredible piece of law. In the community, at this point in time, we have approximately, as we said, hundreds of thousands of people being served through the basic vehicle called a regional center. All 58 counties in California are covered by these 21 regional centers. Initially, they came out in 7 and 5 regional centers. And so as they evolved through the course of that history of this program, representing our constituencies across the board on their boards of directors and under the auspices of review by the 13 area boards, evolved a system that across the United States is still envied. Also within that service system and their responsibility are currently 5 state-operated 24-hour service providers called developmental centers and/or state community-based program. And at this time, those individuals, approximately 1,300, are being served by that state-operated service. What's incredible about this quick snapshot, it does not speak to the significant local-based activities and the evolution of community-based programs that followed. We're impressed by that in California. In the last 6 years, as we will be talking about, there's been challenges that really have had a huge impact on it. As a direct service provider, myself, as a clinician, myself, and all of the others who join me. And we're here to tell you about it, and there will be people in this hallowed place looking, and as Jess Unruh is looking down on us, asking for us, what do we need to do next? So respectfully, it's my pleasure to move the agenda.
Okay. Patricia Flannery. Okay.
Good afternoon. My name is Patricia Flannery, and I am the Deputy Director for the Developmental Centers Division within the Department of Developmental Services. As Santee mentioned, The developmental center system operates 5 facilities, 4 large developmental centers and 1 small community facility. As of today, we serve 1,317 individuals who reside within those 5 facilities. Approximately 30% of the men and women we serve require skilled nursing care or nursing facility level of services. The remaining 70% receive services through the intermediate care facility. Our 4 developmental centers are licensed and certified as general acute care hospitals with distinct parts for nursing facility and ICF care. In 2012-2013, legislation was enacted that imposed a moratorium on admissions to the developmental center system, and since that time, we have accepted admissions only to the Porterville Secure Treatment Area under a court order, and a few admissions into the Fairview Developmental Center under the guidelines associated with acute crisis services where there's no other option available for that individual. The governor's budget for 14-15 proposes the developmental center system budget to be $526 million, which is a net decrease of 5.4% from the projected budget for our expenditures for fiscal year 13-14. There's also the general fund component of that is $275 million, which is a 10% net decrease based on the fund shift of the 4 currently decertified units at Sonoma Developmental Center gaining certification and coming back under the Medicaid provider agreement. The overall decrease associated with the proposed budget for 14-15 really covers a number of different things, but I'll highlight those that I think are the more significant ones. The first is it is built on a reduction in the population in the developmental center system with corresponding staffing reductions that go along with that population reduction. It is built on the restoration of the federal reimbursements, as I mentioned, for those 4 units at Sonoma, which becomes a $15.7 million fund shift from general fund to reimbursements. It is built on a $9.2 million increase associated with the Sonoma Developmental Center Program Improvement Plan. In the 13-14 budget, we were approved for costs associated with what we felt was needed to support the improvements associated with regaining the certification of those 4 units at Sonoma's ICF and retaining the certification in the other 6, now 7 units. Additionally, the net decrease in the developmental center proposed budget is associated with the Lanterman closure. In January of 2010, the department put forward a recommendation or announced the proposed closure of Lanterman Developmental Center. Since that time, the department has been working closely with regional centers, with family members, with residents, with local providers in developing the services and supports necessary for those Lanterman residents to transition out into their local communities. The overall, in fiscal year 13-14, it is expected or projected that we would have approximately 120 residents who will have transitioned out of Lanterman and into a community setting, which begins the year 14-15 with approximately 22 men and women living at Lanterman on July 1st, the start of our fiscal year 14-15. The reductions...
How many are living at Latterman now?
Right now we have 80.
Okay.
The reductions associated with Lanterman Developmental Center closure are in total $22.7 million total fund, $12 million general fund, and that really covers a number of different items that all go over at a fairly high level. The first is a reduction of $33.7 million total fund in the reduction of staff positions because the population is projected to be at 22. On the 1st of July, we propose that we will reduce staff positions by 317. There will be the proposal is an $11.8 million increase in funds associated with supporting the transition for residents to their new location, as well as the costs associated with those staff reductions as we move forward, staff leave, cash or buyouts, as well as potential unemployment insurance costs. A reduction of $2.3 million total funds in the 11-12 and 12, actually in the 12-13 and 13-14 budget, we were approved for 88 enhanced positions to assist in supporting the closure activities at Lanterman in a wide range of areas. We are proposing going into the fiscal year 14-15 that 88 positions would reduce by 40, and so this $2.3 million is associated with a reduction of 40 enhanced positions. And then an additional $2 million reduction to the loss of those 48 enhanced positions once the remaining individuals at Lanterman move out into the community, which at this time is still projected to be no later than December 31st of 2014. The proposed budget also includes 68 positions and a 3.5 increase associated with positions that would come into need January 1st through June 30th of 2015 to support the wide range of activities that are associated with actually closing down a developmental center once a resident is no longer living at the facility. As you may be aware, the Department of Developmental Services is responsible for the upkeep and maintenance of the facility and the equipment at a developmental center until the property is transferred through the surplus property process. Those 68 positions are really built on a number of different functions or activities needed within the system. About 20% of them are just related to 24/7 operations, police services, fire services, operation of the steam plant, all of which happen on a 24-hour, 7-day basis for services. There's another 16% associated with the outpatient clinic. As you may recall, in the closure plan, the department put forward a proposal to operate an outpatient clinic during the closure to ensure that residents leaving Lanterman, once they move into the community, if we aren't able to access health and medical services for those individuals, they could return to the outpatient clinic until we could secure services in the community for them. So there's another % that are associated with operating the outpatient clinic. The Welfare and Institutions Code speaks to the Regional Resource Development Project, or staff associated with monitoring residents in their first year of transition into the community. Those staff work in partnership with the regional center to make sure that when residents transition during that first year, that all the services needed are there. A percentage of those positions are associated with maintaining those required activities, as well as the operations of the Community State Staff Program and the administration of that program. And then the Lanterman campus is approximately 300 acres, with a little under 120 acres that are specific core campus activities. And about 30% of those positions are associated to just maintaining and closing down the campus. The consolidation of property and equipment, as you may be aware, the government code has some very clear guidelines around how we can dispose of state property or property purchased with state funds, as well as records disposal, information systems or IT systems, and that sort of thing. So those are the high-level overview of the governor's budget for 14-15 for the developmental center system. You may recall in 2012 and 2013, the department came forward to the hearings to discuss the circumstances that had occurred at Sonoma Developmental Center. In 2012, the Sonoma Developmental Center had some very significant events that had occurred, and as a result of those activities was found not in compliance with intermediate care facility conditions of participation. In January of 2013, the department entered into a program improvement plan or an agreement with the California Department of Public Health to maintain certification for 6 of the 10 ICF units, and at that time the department withdrew 4 of those units. We continue to work under that program improvement plan, cooperating and working hand in hand with the consultative review expert that was brought into the facility to work at Sonoma, and continues at that facility. In 2013, Fairview Developmental Center, Porterville Developmental Center, and Lanterman Developmental Center all underwent a series of surveys conducted by the Department of Public Health and the Federal Centers for Medicare Medicaid. And at that time, each of those facilities were identified as being out of compliance in at least one condition of participation. In January of this year, the department entered into a program improvement plan with the California Department of Public Health to maintain certification within the ICF units at each of our facilities, but also to contract with an independent entity who would come in and conduct an assessment, help us develop a plan, and then monitor the activities moving forward. Those activities, so we continue to work on the elements of the program improvement plan. We expect to have a signed contract in place and the independent entity on board by April 1st at this time. The contract itself for Fairview and Porterville includes a root cause analysis and an action plan development, and then ongoing monitoring with monthly reporting. The program improvement plan for Lanterman Developmental Center identifies that the independent monitor will come in and complete monthly reporting on all elements of the plan of correction that were developed as a part of that survey to ensure Lanterman continues to provide the level of care and services required through federal certification as the facility continues to close and residents continue to transition out of the developmental center system, or out of Lanterman Developmental Center.
Anyone, you have any other reports?
No, not on the development center.
Any comments from the Department of Finance or LAO?
Luana Welch, Department of Finance, and we have nothing to add to the presentation today.
Rashi Kesarwani, Legislative Analyst's Office. Secretary Dooley has provided an overview today of the report released by the Developmental Centers Task Force on the future of the developmental centers. We note that the report's recommendations to further develop community services and supports and to restructure the developmental centers are positions our office has recommended previously. We therefore find elements of the report's recommendations to be an appropriate first step in addressing the long-term restructuring of the developmental centers system. Moving into the immediate term budget issues on the certification issues at the 4 developmental centers, we've evaluated the department's budget request for Sonoma and find it to be reasonable and appropriate. The budget request of $5 million general fund in 2014-15 is needed to continue to make improvements at the developmental center that are needed in order to restore federal funding and ensure federal certification of the 4 units that have been decertified. In terms of the other 3 developmental centers that were recently found to be out of compliance with federal certification with federal certification requirements, we note that additional state resources may be required to make improvements at each of these 3 developmental centers as well.
Thank you. Okay, we have Tony Anderson and Catherine Bakemore. We need to make a little room at the panel. Maybe some of the Department of Finance folks can, and LAO can move. The others may want to remain because obviously these are still issues concerning program and and concerns that we may have about the budget and its relationship to the programs. Yes.